All right, thank you so much for staying with the Monday Report. The number we are running just underneath your screen, you can call in. If you're lucky, we'll pick it up really fast and pose the question to the Director General, but we have a few more questions coming through. Let's bring them up.
Hello, my name is Newton from JKUAT, Master Student in Nursing. My question is, what measures are there for the patients who have recovered when they go back to the society?
Director General.
Very good question. Reintegration of those who have recovered. One is we need to ensure that we welcome our brothers and sisters who have recovered from this. Of course, it has been a tough journey if you make the recovery and you get back home. One thing I would want to urge Kenyans and all of us is to stop stigma of those who have recovered. And we also, as a ministry, want to see how we can be able to use the people who have recovered from this infection as our ambassadors, so that they can be able to tell, because they'll be taking from a point of actual experience, real experience of what they went through. And therefore, we believe partnering with people who have recovered from COVID-19 will play a crucial role in the fight against the disease, because people will believe those who have had personal experience with COVID-19 disease.
DG, and related to that is what happens to the bodies of the deceased if they die of COVID-19? Will the government take the cost of burying them, or will they release the bodies to the families?
We have developed guidelines, like with any infectious diseases, of body management of deceased persons regarding disinfection, and the precautions to be taken by both the healthcare workers and the family. We have, in terms of the contingency plan, we also have the body bags which are supposed to be used, and in conjunction with the county's teams. If the numbers are manageable, we'll allow the families, under the guidance of the county health management teams, to be able to assist in the burials. But of course, if you are dealing with mass deaths, then the government has to come into force and be able to execute that mandate.
All right, let's bring up another question here, but there's a phone call from Moses from Ruiru. Moses, good evening. Moses, good evening.
Yes, good evening, sir.
Yes, go ahead with your question, Moses.
Yeah, kuna watu ambao wamewekwa isolation.
Yes.
Na wanateta kwamba hali yao ni duni sana.
Wapi huko?
Isolation centers.
Okay.
Ukisema kwenye mitandao wanateta sana kwamba hali zao ni duni.
Okay.
Sijui serikali na mikakati ipi kufuatilia masuala kama haya.
Okay. DG, Moses from Ruiru is wondering, mtawafadhili vipi wale ambao wako isolation centers wanasema kwa hali yao iko duni sana kwa sasa?
Is he talking of the quarantine center or isolation center? Because isolation center is only at Kenyatta National Hospital and Bagathi Hospital.
I believe he's talking about the quarantine center.
If he's talking of the quarantine center?
Yes.
Yes. I talked of the mass testing that we commenced today, and we started with those people who came 8 days ago. And I even told you of the additional capacity that we have at Kemri. Now from 300, we can be able to do 400 tests in 24 hours.
Yeah.
And more centers are going to come on board. Hopefully in the next few days, the Moi Teaching and Referral Center will also be able to offer testing capacity. Additional testing capacities have also come in from the private sector. Of course, Aga Khan Hospital is testing. Lancet Laboratories should begin testing in the course of this week.
DG, his concern was really...
they would have to bear with us so that...
Sorry for cutting you short. His concern was really the state of affairs in those quarantine areas. He's saying they're not up to standard.
The quarantine centers, as far as I know, we have 37 of them, unless he can be able to point out a specific one, in which case we'll be able to address the concerns raised.
All right.
But the quarantine facilities range from hotels to Kenya School of Government, Kenya Medical Training College, Lenana School, and we have not had any issue.
And the other concern is, what if they can't afford to pay for themselves? What happens then?
As a ministry, we are in discussion with the National Treasury to see what we can be able to do. Those discussions are ongoing, and we'll be able, at the end of the 14-day quarantine period, before the end of the 14-day quarantine period, we'll be able to give a direction.
All right, let's bring up another question.
My question is, what if the virus is mutating? Are you prepared for it? And are those test kits up to date?
Okay.
Thank you.
DG? Mutations have been reported in this virus. I've read of an article from Iceland. However, in most of the cases, the virus has remained the same. And of course, mutation can mean either two things. It can mutate into a more serious type of virus causing more deaths, because now the case fatality ratio is about 3 to 4%. Of course, scientists are working worldwide. They are in overdrive trying to get a vaccine. For now, I don't think mutation of the virus is a major challenge worldwide.
All right. Let's bring up another question.
Ziggy, can Dr. Amoth explain or give us a breakdown on the money donated by the World Bank and the money donated by the CBK, how it has been used?
DG?
World Bank initial commitment was 1 billion Kenya shillings, which has been received. And that is what has been deployed to be able to purchase the PPEs, the ventilators, the test kits, supporting the training, a bit of communication. Then an additional resource of 5 billion Kenya shillings is expected in the next few weeks, which will continue to support the counties in terms of capacity building, establishing the isolation centers and quarantine facilities at the county level.
All right.
I'm not quite aware of the donation from Central Bank of Kenya. That is not in my know.
Okay. All right, let's bring up another question.
My name is Nixon Dugere from Kindaruma. Daktari, for how long should one stay with one mask? Or can one rinse the mask and use it again and again and again?
DG?
Our earlier communication is to the public is that masks are only supposed to be used under two circumstances. One, if you are sick, that prevents you from passing out the droplets, or if you are a healthcare worker taking care of the sick.
All right. There's the last question here.
In other circumstances...
Sorry, go ahead, DG.
In other circumstances, you may not be required to use the mask because, one, it is not a familiar tool for you, and it may not be well-fitting. So it actually can be able to put you at risk, because in trying to adjust it, you'll be able to touch a surface and probably even touch your face, your nose or your eyes, and therefore put you at risk of infection. Again, masks are now a very scarce resource. Please, let's deploy them to use where they can be able to give us the maximum dividend.
All right. Let's bring up another question.
Dr. can you have all those infected with COVID-19 revealed to us? I think it would be easier for everyone to identify if they interact with any of them at one point. And with that, we'll be able to quarantine the right people. But for now, we are just guessing and trying to confirm the people they interacted with.
Is that an option, DG?
Sorry, I didn't get to the first part of your question.
To bring up the names of these people who are infected so that the people who interacted with them can come forth rather than you looking for them.
It is our role as Ministry of Health and national government to be able to look for them. We are in contact with these people. The risk of their disclosing their names, of course, even as patients, they have the right to privacy. And I think we are in constant discussion with the patients who come into the isolation unit. They are very cooperative in disclosing the information of the people they have come into contact with. And it is working well, and I don't see why you should be able to disclose their names, because that will only encourage stigma. And with stigma now, people will go underground. Even those who have the disease will now not fear coming to the public health facilities to seek services. And therefore we'll have clusters which will snowball into widespread community transmission.
All right. DG, finally, what is your message to Kenyans tonight?
My final message to Kenyans, and I want to echo the words of my Cabinet Secretary, Honorable Mutai Kagwe, that this disease is going to treat us abnormally if we continue to behave the normal way and continue doing business the normal way you have done. My final message to Kenyans, fellow Kenyans, is to change our behavior. Let us practice hand washing with soap and water. If you have a sanitizer, please use it. Let's maintain social distancing, and together we can be able to conquer this scourge. Failure to which the numbers that we shared with you will only rise. And if they rise, the healthcare system will be totally overwhelmed, and we'll see the situation that is currently obtaining in Italy and Spain. However, if we take these measures, we can be able to stop the transmission, flatten the curve, and ensure the safety and health of all Kenyan people. Thank you.
All right. Dr. Patrick Amoth, the Director General, Ministry of Health, thank you so much for being gracious enough to answer Kenyans' questions tonight on the Monday Report. I'll let you have some rest now. This has been the Monday Report, and your questions have been answered by the Director General. We'll definitely get all your questions in next time around, all right? It's a good night from me and the entire team that made this possible, and thank you so much for sending in your questions. We are here with you up until the end. This, I promise you, we will win this war. All right? My name is Trevor Mbija. Always a pleasure having you with us. Stay safe, stay clean, protect your family. All right? Good night.